Hello friends, it's pleasure to have you back on the channel of Clinical Care Insights. In our today's podcast, I'm going to explain you about the coma. Coma is the state of a body and a brain where persons loses the contact with reality or the contact with the surrounding environment. In the case of coma, there is a loss of consciousness. Consciousness is the property of a brain which makes us aware about oneself as well as the surrounding. But whenever the coma occurs, patient loses the consciousness. Imagine there is a road traffic accident. A 23-year young boy fall from the bike. Now doctor teams arrived. Boy is on the land with high sound intensity. Doctor pronounce his name. No response from the patient side. Then doctor make her body move and ask their name. No any response. Then doctor pinch their nail bed and asks. Then patient shows certain movement. Now this kind of state is considered as a coma state where persons have the very less awareness or no awareness about the surrounding. Now what actually happens in the case of coma is in our brain there is one system, we call it reticular activating system. This system actually is present in mid between the brain hemisphere and the body. Actually our body and our brain is always in communication. Fine. And this communication, it is mediated or it is channelized by this reticular activating system, which is made up of from basically some special nuclei of certain neurons. But whenever this coma occurs, the RAS system actually become dysfunctional. So no information reaches to the higher system, means your hemisphere will not get the information about the body. And slowly patient goes into the permanent state of sleep. Actually reticular activating system is also off during the sleep time, during our sleep time, because during our sleep times we do not want disturbance, our brain do not want disturbance, so it just off the reticular activating system. But in the case of coma, this is for a prolonged time or sometime this is for till the death. Now there are lots of cause which actually triggers the coma states or which actually cause the coma. First one is called as electrolyte disturbance. In our body, the message going and coming is done by the electrolyte activities like the sodium, calcium, potassium. Fine. So if there is a deficiency of this electrolyte, then that can cause the coma state. Apart from that, TBI, traumatic brain injury, in the sudden hit to the brain or the small blood vessels, they goes to your brain and supply the blood to the brain. Fine. So if due to the high blood pressure, that vessels, they are already very vulnerable, and due to this high pressure they get rupture and make the hematoma in the brain, that can also cause the coma. Apart from that, there are certain infections like the encephalitis. Fine. These infections, toxins can also lead a person into the coma state. Apart from that, the energy deficiency, that is the hypoglycemic state. Your brain always love to have the steady supply of energy. If you disrupt that supply, your brain have sudden shock and your brain will go into the coma state. Now my friends, you may thinking about the appetite of a coma patient. So for your kind information, I would like to tell this that coma patient, they did not feel any kind of hungerness. It is the part of a treatment by which through the nasogastric tube, doctor feeds a patient. Apart from that, coma patients, most generally, they do not feel the pain. But there's one scale which we employ to check the improvement or recovery of a patient. We call it Glasgow's coma scale. In this scale, actually, we are checking the three response. First one is called as the verbal response. Second response is called as the eye opening, and third response is called as the motor response. Fine. So generally, the coma patients, they won't have any kind of these response. Fine. But during the improvement, they show certain movement. So there's a motor response. They follow the command actually. Then by shouting their name loudly, they can even respond verbally. Fine. So by checking these things and by checking the MRI and CT scan, we can easily check the improvement. Fine. So sometimes recovery can be done in a one day, sometimes take months, sometimes year, or sometimes patients not recovered and they goes to the next stage, that is called as the death. Fine. So coma is the mid stage between the life and the death. Fine. Certain people can recover, and other persons, other comatose patients, they won't recover easily. Now, my friends, I would like to explain one more thing, that is the difference between the coma and the death. Actually, in the case of coma, what is happening, this is the, for a long time, this is the unconsciousness, fine, or you can say the unresponsiveness of a patient. So there's a loss of consciousness, but still the patient's breathing, the heart rate, it is going on. But in the case of brain death, this is brain death is permanent. Fine, the consciousness is also getting lost in the death, but this is the permanent and it is the irreversible. Apart from that, brain death, and there is a loss of heart function and lung function. So we use this criteria, the brain death, loss of the heart rate, and loss of the pulmonary, that is the lungs functionality, to declare the death. So friends, this is all about the coma. If you have any questions, we would love to answer your queries. You can comment down, and apart from that, you can also suggest us the different topic which you want to see the video. So thank you with having us. Bye. Have a nice day.